Hi, I'm Rose DiMattina, and this is Lift High the Cross, a program dedicated to the teachings of the Catholic Church. Our guests today are Liz Schiavone from the Arlington Diocese Council of Catholic Women, and with her is our other guest, who is here from Tepeyac Center, Will Waldron. Welcome, Will.
Thank you.
Liz. And thank you both for coming. Now, I know you both want to talk about Tepeyac Center and Divine Mercy Healthcare. Who wants to go first talking about this?
I'll just go saying, introducing that I knew Dr. John, who was the founder for a long time. I know Will because he's great. He's the executive director. And I think of it as a place of excellent medicine. Mm-hmm. We have 11 grandchildren, most of them born there. 2 of our daughters work there, one on the Divine Mercy Care side and the Tepeyac side, and one on the Tepeyac side. So I just think it's a wonderful place. I think it's very good. It's based on, the Catholic faith, Christian, ecumenical, but and I think Will should do the
Will.
background.
You work there, so
yes.
So tell us what you do. And
absolutely. Well, thank you for having me. I'm excited to be here. Divine Mercy Care, which is really the kind of the overarching parent company of Tepeyac OBGYN. And Divine Mercy Care has 3 portions of its mission. One is to serve, we do that through underwriting the support for the women in need at Tepeyac, and we support the pro-life medical work that is done at Tepeyac. The next portion is we educate and inspire, and we really do that to educate and inspire the next generation of pro-life medical providers. So your next round of OBGYNs or nurse practitioners, we want to be there to help inspire them to take that leap. And it is a leap of courage, for sure, for these providers. And the third aspect is one I'll talk about a little bit later, but it's really our unification. And really trying to unify, bring together those pro-life or life-affirming medical providers and practices throughout the country.
That's wonderful. That's wonderful. Now, how do you propose to do this, to go through the country? What are you doing to do that?
So actually, this is right on the heels of our launch that we had this Thursday. And we're excited to announce Pro-Women's Healthcare Centers. And this is really a movement that is focusing on the standards of healthcare. And those are Catholic in their foundation. They follow the Catholic Church, but very much ecumenical in opening other centers that may not be Catholic affiliated, but certainly follow or adhere to the standards. And it's really the level of care that we want to focus on, because we're at the core of what all pro-women's healthcare centers do is care for the woman. And that's in a holistic way, not just in her medical care, but how is she in her counseling? How can we help her if she has a loss of a child, and how will she cope with that? So if we don't actually do it at Tepeyac, we will partner with groups very close to us that can help us in that journey for that woman.
So we'll also help prenatal or postpartum depression, whatever.
Absolutely, absolutely. The idea there is that good health care is really is holistic, and it's comprehensive. You've got people who don't necessarily agree with how the 3 of us agree with here, and how to that's life-affirming medicine, and they proclaim that they have health care for women, but the reality is it's not care. It's not really caring for them. And you'll hear our doctors at Tepeyac, and even the doctors from all these pro-women's health care centers, they want to meet the woman where she's at and really listen to her. Because true care for any individual, whether that be health care or otherwise, you listen to that person. Right. And it's connecting with them and try to accompany them. Our Pope talks about that accompaniment.
Yes.
And that's really what we like to do.
That's very important.
Well, I was going to say, and I think sometimes that people forget that as Catholics, we do things because we're Catholic, not because somebody else is Catholic.
Right.
And I think sometimes, that is like when you're saying the mission is your mission, but it's not just for Catholics. And I think a lot of times people confuse that. Of course, we're going to have what we believe, but at the same time, we do these things because we are, and the church does that. I mean, when you think back, the church was one of the first places to have things for the AIDS. And people don't realize that. I mean, we do things where we had the first school system, we had the first hospitals, and people don't realize that a lot of times.
Yeah.
And so
The
this
principle of subsidiarity, really helping your fellow, man and woman to your left or your right.
No matter who they are.
Yes,
no matter who they are.
absolutely.
And I think the mission that you guys do help the poor, and they have a gala every year that the money's used to help, and 30% of the patients that come through Tepeyac, the Tepeyac part, are non-pay.
Absolutely, and that is part of all pro-women's healthcare centers, is that that part of their mission does provide for the ability to take care of those that are less fortunate.
How did Tepeyac begin? I mean, where did it start
That's
from?
a great question. So literally, I would say about 30 years ago, Dr. John Bachowski had a real conversion back to the faith, and he will tell you that himself, that he wasn't necessarily in line with the Catholic Church in his own journey, and it was through a visit to Mexico City and Our Lady of Guadalupe, and then also another visit to Medjugorje, that these life-changing, altering moments for him. And where he really felt the Blessed Mother visited him and said, you need to practice women's health care. You need to care for the poor. You need to do and trust in my son's teaching of the church. And you need to do this without exception and with excellent care and excellent medicine. And so 24 years ago, this is the 24th year that Tepeyac has been up and running in Fairfax.
That's wonderful.
And the thousands of babies that have been born along the way. And it went from Dr. John Bachowski to now 5 doctors. Dr. Marie Anderson was the next physician that joined. Dan Fisk was after her. Dr. Miriam Pereira and Dr. Lorna Savekovich round out the 5. And they all have their own, areas of core expertise. Dr. Savekovich, all the other doctors will say she's the best surgeon. Excellent medicine. And, Dr. Anderson has a wonderful apostolate really of helping with prenatal or perinatal hospice, where you've got that maybe that really sad diagnosis, maybe a miscarriage, and she's a wonderful really nurturer and listener for a woman who's in those situations. So it's really, like I said, it's excellent medicine. 2 of those doctors have been the chairs of their department at Fair Oaks Hospital. So it's, they're very well respected by their colleagues. And we like to really talk to that, the excellent care and excellent medicine with also, seeing the poor and seeing those that need it.
How do you see the poor? Do people come to you, or do you go out into the neighborhoods?
A little bit of both.
You do?
When
Okay.
it was first started, Dr. John Bachowski definitely went out to the pregnancy centers and partnered with them and said, send me your women, send them. And even today, that still goes on. We have relationships with pregnancy centers to have them come, particularly abortion-minded women who are on that fence. And then even most recently with the Diocese of Arlington's opening of the free clinic in Manassas, we've entered an agreement with the diocese that Divine Mercy Care will actually underwrite the care of one pregnant woman a month to be able to have the care at Tepeyac. And so she will not have to pay anything, and Divine Mercy Care will raises money to do that, to make sure that she has that care.
How long do you follow the women from prenatal to?
Through to delivery, and we even have a program for women who don't have insurance or are underinsured as well for their gynecological care. So postpartum as well.
Oh, that's wonderful. Now you mentioned you're expanding. You're going. How are you the prototype? Is Divine Mercy Care the prototype, or Tepeyac the prototype?
That's a really good question. I think we're really feeding off each other. There's a great similar practice called Bella in Denver, and they actually were inspired by Dr. John 4 years ago. Came out, sat down with him, saw what Tepeyac does, and Dr. John says, "Well, here's where we've made our mistakes," so they could actually learn from that. And they do some really interesting things that even today we're learning how they're doing some things. Different things such as hormonal therapy, and really helping women through their menopausal stages and later on in their gynecological lives. There's a group out of Arizona called Morning Star, Dr. Clint Leonard and Christine Arcuso, who's their practice administrator. They're doing some amazing. They're actually a for-profit model, and they also see the poor. but they're so busy. They need another doc. They're delivering 35 plus babies a month. They need desperately another pro-life OBGYN to help out down there. But they're doing some neat things too, where they're partnering up with the diocese and really doing some wonderful, wonderful things. So we're learning from each other. I think a lot of them were inspired by Dr. John and Tepeyac, but we're also learning from
You're
them.
learning from each other. That's
Yeah.
wonderful.
Well, and if you never fail at something when you're saying, I would have done it different,
Yeah.
then you're not doing anything.
Right,
Because
and you don't
steps
learn.
in the journey are always the journey.
Absolutely.
I mean,
Right.
when
Yeah.
you think about our saints,
Yeah.
yeah,
There's
they weren't always doing everything
So
right.
true.
Most of them.
Yeah, I think St. Augustine is my favorite, but yeah.
That's wonderful. Now tell us more about the programs. Do you follow babies then after they're born too, or do you provide care, or how do you do that?
Well, we actually, this year, Dr. Hayden has joined the practice. Well, actually, he's subletting space, and so he's a general practitioner, so he can see pediatric patients, so he is seeing them. He is an interesting model in and of itself, where he's kind of what we'll call a fee-for-service. So he has a kind of a subscription-based, monthly fee, and my family, we take part in it.
Yes.
We, so my children can go and be cared for him. We have unlimited visits, really. So it could be the flu one week, it could be stitches the next week.
Yeah.
And he's a wonderful caregiver. And so they do that. I think there's also, we partner up with other pediatric offices as well. McLean Pediatrics is another one that we work with, and they're, again, in line with us,
Right.
with how we practice
pro-life.
medicine. Yeah, absolutely.
And this is open to everyone, not just Catholics, anybody.
It's absolutely open to everyone. In fact, honestly, the demographic of our patients is really about 50% Catholic, maybe about 30% some denomination of Christianity, probably 10 or 15% Muslim, and then another group of people who just really appreciate, and they might be agnostic or just not really practicing any faith, but really appreciate how medicine is done there. The whole idea of no chemical contraceptions, right, or any contraceptive for that matter, but this idea where we live in a society where they're telling us, well, you need this medicine or you need that.
Yes.
Our daughters, I have a 17 and a 13-year-old daughter, and I shudder to think if I brought them to a secular OBGYN and the conversations that I've heard happen at other OBGYNs that they, well, you're of that age, then maybe you should start, taking the pill.
Yeah.
So
Which
it's scary.
is so interesting, because if you are for women, they're worried about the pill now affecting the environment. So if you're worried how the pill affects the environment, what do you think it's doing to a woman or a young girl or a young lady's body?
Well, it's
And
been linked to breast cancer later on in life,
Yep.
so that's,
So, I mean, it's just, you've got to think, if you take out even the whole pro-life, why would you be saying we're concerned about the environment, but this is good for you to have?
yeah.
And it always kind of, and it's like we're now in a society, and don't get me wrong, I think it's great that everybody's really healthy, but they're into, exercise, they're into being vegetarians. I was a vegetarian for 7 years. They're into all these different things, but then they put this chemical in their body. It's like totally,
it's a contrast,
It's
right?
totally in conflict with what you're
Yes,
supposed to be.
absolutely.
Yeah.
and I do think you have some people moving away from that because of it. They're realizing it, but that really needs to be communicated versus
Just put under the table and not spoken about.
and all the
basically.
side effects. Like you were saying, whatever the side effects are, you need to know what the side effects are.
Now, what about infertility? Do they deal with that?
Absolutely,
How do they
absolutely.
deal
We've
with
got
that?
Dr. Zvekovic has been Creighton trained, and so she's in the NAPRO technology. So she's a surgeon who can perform that. But really, also, there's other methodologies out there that can help women in their fertility and trying to help them navigate what's best and what will work best for them.
What is the NAPRO?
NAPRO is I'm not a physician, so it's
Yeah.
a little more difficult for me. But from a layman's terms, I think it helps women, I think, who have conditions such as endometriosis or other things that can be barriers to pregnancy.
Oh, okay.
And so they're through surgical. It was Dr. Hilgers, who out in Omaha, Nebraska, was really at the forefront of this and has been pushing it probably, I want to say 20 to 25 years now.
Oh my goodness.
And Dr. Zvekovic was one of his first surgeons who came through and was trained on it, and she's been with Tepeyac now for 10 plus years.
So, in other words, you not only deal with crisis pregnancies, you also deal with people who want to have babies
Absolutely.
and can't.
Yep,
Right.
That's
for sure.
And I know several people that have gone to Tepeyac for infertility. You know,
And what
just-
is the success rate with that as far as?
That's a really good question. I honestly don't know.
Okay.
I think, I think it
depends
also
on the
depends on the
person.
woman,
Yeah,
in
probably.
her scenario. And the other amazing thing I think about it as it relates to our faith is how we've all known the families where the first child they adopted, but then after that they were able to naturally conceive.
Yeah.
And I just find it amazing that I think some of it is it's God's plan, obviously, always. But I also think it's amazing that, there's no better nurturer than mom. And I think when mom is there and she's helping and nurturing the family, and there's less stress on her on professional world and where she should be, it's really it's amazing how the body reacts to that.
It's true.
And I think
true.
we've all seen it with
It's
friends.
so important, yes.
Well, and they do a lot of things because the Women's Council, we help, and actually, my daughters ran the galas way before I helped, or I helped, but I never ran the galas when they worked there. They have galas that raise money for this. Usually it's in November. But they have a memorial service too. Tepeyac has a memorial service for people that have lost children regardless how. So you don't know if it was through abortion or whether it was through miscarriage or whatever way they lost death, whatever. And I think it's a beautiful service. It's, again, open to everybody, and it's just beautifully done. And I think there's a lot of healing there for people that come. Now, by the grace of God, that's never happened to me. But it is, it's God, like we
Yes.
said, because we believe that. So you want people to be able to honor their children if they choose to.
Of course.
And they can either say no name, they can put their names down, they can do. But I think I think it's wonderful.
It's important for healing.
Oh,
is.
absolutely.
Yeah.
These women will tell their stories, and I think it's just part of the next step in their journey.
So-
Really.
Right.
So Tepeyac reaches out to the poor. You have people who just have the insurance and can come over.
Yeah.
Tell us some more about the center. What else do they do?
So we help women in a variety of ways. Honestly, I think we've on site we've got a laboratory, so they can do testing. Whether that might be STD testing. It might be just testing. Obviously, if they're pregnant and they're going to be expecting. We have a teen or adolescent healthcare program where we literally are sitting down with young women and helping them understand their bodies better, helping them realize the risks that are inherent with engaging in relations, particularly outside of marriage. And so that's a program that, again, you're wanting to educate people and educate these women on themselves, their choices, the consequences of them, and it's so much in line with the church.
And it's making them take responsibility for their actions too,
Absolutely.
understanding what's going
Yeah.
on. That's really
And we do a lot of outreach. Our doctors very often will go into parishes and talk about these issues, and it's really in line with what the priest is talking from the pulpit. It could be on having a chaste life as a single person, or understanding contraception on a deeper level, and the pitfalls of contraception.
Do they talk about natural family planning too?
Absolutely.
Yeah.
And we're kind of a group that we will engage in all types of natural family planning, all methodology, because again, you not knowing it's when you really know the woman and know your friend, right? And you can give best advice to a friend when you know them so well,
Yes.
right? And that's the aim of our providers, is to really sit down with them and get to know them in their situations. And there's about 4 or 5 very well-known methodologies, and to figure out which ones will work for them, which fertility-based awareness method is best for them.
Yeah.
And I forget to mention too, we've got a midwife.
You have a,
Yeah, Kim
okay.
Terhune. She came on a year and a half ago and has been wonderfully received, and for a woman who wants that experience.
That's
And
wonderful.
but the midwife is always backed up by one of our physicians. So if anything were to go a little bit more complicated, that the physician is there.
Are you affiliated with a hospital, or do you?
Fair Oaks Hospital.
Fair Oaks
Yep,
Hospital.
that's
okay.
where all of our physicians and our midwife are credentialed, and that's where we practice.
That's wonderful. Liz, you look like you want
No,
to
I was going to
something.
say no. Well, that's where the ones were all born. But I was also going to say one thing that we had talked about earlier, that One time, the Women's Council helped host for them was a lunch and learn with the priests, and that gets the priests out from the parish. Just many of them know it, but to really understand it, like you said, because I think there gets a confusion. Okay, so you have Divine Mercy Care, that is kind of the umbrella, and then Tepeyac's. So I go to Tepeyac, and several of my daughters go to Tepeyac, but then you have people, 30% are coming through that are not, paying or in need, which is what we're supposed to do, poor, working poor, whatever. But they're all in the same place, so it's not like a clinic, and that's what I think is so unique. So. And to get the information out where people understand that, because a lot of times people either think, a clinic or a doctor's office. It's both. It's a doctor's office, but it's incorporating everybody. It's open to everybody, which is unusual. It's an unusual.
So many times women who are pregnant who don't know about Tepeyac or something will avoid going to the doctor because they can't pay.
Yeah.
And they'll wait until the last minute and go to an emergency because emergency rooms have to take you, according to federal law.
Yep.
And that's so unhealthy for the baby.
Absolutely, and very high risk for the mother as well.
Yeah.
And you're absolutely right. And we do take Medicaid and Medicare patients, and so we want to be in about 40 different insurances.
But even people who don't have anything, you take them
and
too.
we'll take them, yes,
How
absolutely.
does one go about getting an appointment with you, or what do they do?
Well, one of the first things they can do is call up Tepeyac, or they can go online and reach out, go through Tepeyac, or they can reach out to divinemercycare.org, and they can find out more about what's going on in the pro-life medical movement, really, and the different things that we're working on.
Now, Divine Mercy Care, though, is the parent company, sort of?
Yes.
And do they have others besides Tepeyac, or is that?
Well, the other big programs, what we talked about before, is the Pro-Women's Health Care Centers.
Right.
That's the most
And
recent.
I happen
you
to have a
something here.
brochure.
It says something here.
I couldn't make it, unfortunately,
Yeah.
but I don't know if
So that's,
maybe
we're really excited about that. And the other aspect, like we said, we're coming up on the 25th year of, next year, a year from
That's
now, we'll be in
amazing.
that 25th year. And we've got a lot of things planned to celebrate. We've got a lot of things to plan there and execute on. So we're excited. Liz had mentioned before the gala, and Liz has been, she will downplay her role, but her role has been significant. Really to the tone of raising over the past 14 years, 14 different galas, probably in excess of $3 million.
Oh my goodness, Liz.
So she's a force of nature.
Yeah.
We're really,
I noticed that.
we're really blessed. Good for Liz.
That's wonderful. Is there anything else you want to add about Tepeyac, or how do people go about donating to Tepeyac besides the gala? Do they just write to you, or?
No, if they want to visit the website at divinemercycare.org, that's the best way. We've got people from all across the country, 44 different states. People are residing and giving and supporting. But there is a vast majority in the Northern Virginia area who support. But we're really blessed. What we're able to do, the mission that we have, and that is to support these women, to really promote, educate, and inspire the pro-life medical movement is really a wonderful mission.
Do you find it growing, the pro-life medical movement?
I think so, particularly with this pro-women's health care. You're finding that people want this. We brought together these 6 groups, and they're all nonprofits except for one. They all have a board of managers that this was not on their radar screen 15 months ago, but yet they thought it was important enough that we need to band together. Because the opposite of us, that other organization that gets a lot of federal dollars, they're very well organized. They're very good at marketing.
Yes.
They're very good at getting federal
Propaganda.
dollars.
Yeah.
But they're unified. And I think there is where the pro-life medical movement has been missing one element in that unification. We're all stronger when we come together.
In the pro-abortion, pro-choice, whatever you want to call it, industry, they call it women's health care too, except it's not.
It's absolutely, you're right.
It destroys women.
It does, in of so many ways.
Yeah.
Physically,
Mentally,
spiritually,
spiritually.
yes.
It's we've had people on the show who've had abortions.
Yeah.
And it's been a horrible experience for them.
And the other thing that that Dr. John Bachowski's been working on with Abby Johnson is, and then there were none. It's an organization that really helps receive former abortion workers back into the world and helps them find their new job, helps financially support them, nurture them, counsel them. It's really a wonderful thing.
That's wonderful. Have you
Yeah.
had a lot of experience with that at Tepeyac too, or?
A few women for sure we've come across in our paths. Obviously, Dr. John and his whole conversion story.
Yes, yeah. So, Liz,
I was just going to say, so the gala's upcoming in
Yes,
November.
November 10th.
November
And then
10th.
we have the Women's Conference with Family Life, March 10th at St. Joe's. It's going to be Diane Foley, whose son was decapitated on TV by ISIS. And always support Catholic charities. They help a lot of people.
Yeah.
We're lucky to have the bishop we have. We are very blessed, and
We are.
we're really just in a fantastic diocese
I'm
that
so glad.
reaches out to everybody. So.
So the gala, how do people go about getting tickets for that? What do they do?
Well, it hasn't, but it will be advertised, and it will also be calling Tepeyac or Divine Mercy
Divine
Care.
Mercy Care,
And-
yep, that'll work.
and-
And we always advertise in the Herald.
Okay.
The Catholic Herald will
Okay.
be there.
And
but
anyone can attend the gala too?
absolutely, the more the merrier.
Good,
That's what we
great.
like.
Well, we're almost out of time, I see, so I want to thank you both. I want to thank you so much, Will and Liz, for coming on the show. I appreciate it so much.
Well, thank
And it's
you.
been so informative. Thank you so much.
Well, thank you.
And
Thank you.
thank you all for coming and visiting with us here on Lift High the Cross. We hope we'll see you again soon. God bless you.